So, what's normal eating, what's disordered eating, and what's an eating disorder?
Let's talk about it.
All right, let's go.
So when we start with normal eating, we're talking about we want it to be regular, we want it to be predictable, we want it to be flexible, and we want it to be spontaneous. So when things are getting in the way of all of those, not so regular anymore.
Okay, so then wait, what's disordered eating?
So when it's inflexible, when it's irregular, when you're finding yourself really swaying to diet trends, right? And sometimes things are camouflaged as normal, but are absolutely disordered. Have you ever heard any of those?
Yeah, I mean, I know when it becomes like an eating disorder.
Yeah.
So I'm curious, like, if we can explain that line of when it's disordered versus eating disorder.
So disordered eating sometimes are things that creep up on you. They felt really normal, and then all of a sudden you realize you don't feel safe, you don't feel confident. There's a lot of feelings that seem attached to it. I had dinner, and then why do I feel guilty? That's when we really get into emotional eating, disordered eating. It can be a little treacherous.
Yeah.
Thinking about eating disorders, what comes up for you?
Well, I think really the main thing with an eating disorder and how to kind of distinguish the two is when it starts impacting almost like your day-to-day functioning. Like you maybe are always late to class because it takes you too long to get ready because, you know, you're spending hours like trying to figure out what to wear, or you're not really hanging out with your friends because they always want to go get lunch and lunch is not something you do.
Right.
Like that's usually when it starts impacting, whether it's relationships or academics, work, like things like that. That's when we know it's like starting to become maybe more in line with an eating disorder.
How do you figure out the difference?
Well, I think that's important for us to talk about.
Oh, good. Let's get into it.
Okay.